Awesome. Everybody ready? Sorry, we've been keeping you waiting. If you don't know, my name's Jeremy Cockrell. I have the privilege of serving as the MLA for the Battlefords and also in our provincial government as the Minister of Health. Today, as you might be aware, our provincial cabinet is meeting here in North Battleford, and excited to host some of my cabinet colleagues here in the Battlefords, able to really show off to my colleagues the great things about our community and what's happening in our region. We're joined at the beginning of cabinet by the Mayor of the Town of Battleford, Ames Leslie, and the Mayor of the City of North Battleford, Kelly Houghton. Two people who I have a close working relationship with as the local MLA, and who, three of us work very closely together to make our region and our community a better place to live. We had a great discussion this morning about several priorities for both local municipalities, both city and town, in terms of how us as a provincial government continue to work with these two municipalities to make life better for the citizens of Battleford and North Battleford and the surrounding area as well. One of the key topics we did talk about this morning was around changes to the Criminal Code of Canada, specifically around bail reform. This has been an issue in our community for quite some time, that we have the largest RCMP detachment in the province, and recently announced the Saskatchewan Marshal Service will be opening up their second regional facility here in the Battlefords. We expect that to be open and operational this fall. The challenge, though, is that the men and women in uniform who serve, whether it be for the RCMP or as community safety officers with either municipality, and soon to be with the Saskatchewan Marshal Service, is that we see the same repeat offenders committing violent crimes in our community. And obviously that has an effect on how people in our community feel about safety in the Battlefords, but it's also important that if you commit a criminal act, that you pay the consequences for that act. And so in light of that, the two mayors and myself and Minister MacLeod, our Minister of Justice, joined this morning to sign a letter to Minister Fraser, federal government minister, to really continue to emphasize the impact that not making changes to bail has specifically in our community, but also really just across the province, and I would say across the country as well. So I do appreciate Mayors Leslie and Mayor Houghton, and of course Minister MacLeod, in hearing kind of our feedback locally here in the Battlefords. Signing that letter. This is an issue that I know the Premier has raised specifically with the Prime Minister, and ministers like myself and Minister MacLeod will continue to raise this with our federal counterparts. And again, we sure appreciate the collaboration with the two local mayors here in the Battleford to join us in that call today. So with that, I just wanted to make those opening comments, and we're all available for questions and comments from any of you. So thank you.
Premier Moe, we have a question regarding the order of emergency state in the province. We want to know exactly what it gives the power for the SPSA to do on the ground with the emergency state declared during the period.
With the state of emergency, when it is declared, we'll often state on the first page a number of various things that a state of emergency could declare, and then we will often see later in the actual requisition or the order is specifically what the SPSA is looking for in that particular state of emergency. For example, in other jurisdictions this year, we have seen where the state of emergency was actually used so that they were able to procure facilities, large facilities for people to stay in from time to time, whether that be hotels or soccer centers or things of that nature. State of emergency is not necessary for a number of other operations that the SPSA has as well. There is often in a state of emergency some clarifications that will provide some opportunities for municipalities as well to act quicker, to maybe evacuate their community, to support their community, whatever that might be. And so in each state of emergency, when it is declared, may be so for slightly different reasons, and those will be laid out in the state themselves.
So just to be clear, when the province decided to declare the state of emergency, what
Yeah.
it gave to SPSA across the
Do you want to
province,
comment on this, Tim, a little more specifically? I think you're speaking to the one a month ago or so that expired. Yeah. Go ahead.
is access to facilities to keep or to host all the firefighters that were coming to fight the fires.
So when a provincial state of emergency is declared, as the Premier said, it opens up those opportunities, those additional opportunities if you need to procure evacuation centres for congregate living and things like that. But what it also does is it elevates the level of urgency that we have under the CIFC agreement, which is where other provinces, we all loan each other airplanes, firefighters, firefighting equipment for wildfires, things like that. And so when we've declared a state of emergency, it's really raising awareness across the nation and elevating the urgency of the need to exchange those resources. And we are very grateful for our partners across the country that stepped up and did indeed offer some of those services.
My question was what it gave on the ground, and you mentioned firefighters from other jurisdiction, but they were already en route before the state of emergency was declared province-wide. So what did the state of emergency provincial, like wide, gave to the firefighters on the ground to fight the fires?
Well, again, it offers the ability to, for a number of options, some of which are used, some of which are not. It does elevate, again, the level of urgency, and it gives additional powers to the SPSA in the event that they need to use them, whether that's for the flow of traffic, for evacuations, controlling traffic on roadways, things like that, as well as the Premier mentioned, to acquire certain facilities if that's needed for congregate living or things like that. The SPSA in our situation in Saskatchewan didn't require to use those on the ground. We have great relationships with a lot of the hotels in a variety of communities where many of our evacuees were housed.
I have a question for Premier Moe. The opposition announced today is pushing a new FOI request showing more than 2,000 publicly owned housing units are vacant. With homelessness skyrocketing, particularly in Saskatoon and Regina, what is being done to make sure these units are both suitable to live and get people into them?
And I think that's down about 30% from a year and a half ago as well. And so we continue to ensure that the housing stock that Sask Housing Corporation has is, being fixed when it needs to be, the repairs are done, and that it's being made available. In fact, that was part of our discussion this morning, even here in the Battlefords, is, how do we best support people that need a home and may be in a vulnerable state often. And I think one of the more recent supports in the city of Saskatoon had identified about over 80% of those individuals that may be living without a home are also struggling with addictions challenges. And so it needs to be about more than just providing a home. It needs to be about providing recovery supports. And that is why you're seeing this government invest heavily, not only in the capacity of recovery beds that we have in the province, intensive recovery beds to provide opportunities for those that unfortunately have become addicted to, very poisonous drugs like crystal meth and fentanyl. We're also expanding the access to those recovery beds. You see that through the Urgent Care Centre in Regina, which we will be building another in Regina, 2 in Saskatoon, Prince Albert, Moose Jaw, 1 coming right here in the Battlefords as well. There is an access point to those mental health and addiction services through those types of investments. A new way, what was a pilot project, but a new and somewhat innovative way to look at not only urgent care, but mental health and addictions access to those recovery services. At the end of the day, in addition to providing houses, of which we have more houses available through Sask Housing Authority today through a focused effort, in addition to providing those recovery services, we also need to enforce the law. And we need to increase the consequences through the Criminal Code of Canada, but also through every opportunity that we have provincially. And Minister McLeod has made some of those moves in recent weeks. We need to enforce the law, and we need to keep these drugs out of our communities. Crystal meth and fentanyl have no place in the Battlefords, and they have no place in any other Saskatchewan community, nor do they have any place in Canada. And we should all be doing our level best to do what we can to eradicate the presence of those drugs, because they're indiscriminate and they are no longer a community away. They are in the communities where we live, and they're killing our friends and they're killing our family members, and it needs to end. So housing is part of that, recovery is part of that, enforcing the law is part of that. Why you've seen investments in enforcement entities in the province, whether it's the additional RCMP officers, the expansion of the RCMP base here in North Battleford, but also the introduction of our Saskatchewan Marshal Service to support the work of our municipal and RCMP officers in the province. I just want to touch on the emergency order as well. There are a number of type 2 firefighters, for example, that are coming in. They'll time out, we'll bring others in. When you have that emergency order in place, it most certainly does elevate you with respect to the agreements that we have with not only other provinces, but a number of states throughout the U.S. as well. And these have been solid asset human resource sharing agreements that we've been able to contribute to in years gone by. I think a year or two ago we had firefighters and assets in Northwest Territories. We've had them in the U.S. In years gone by, and unfortunately this year us in Manitoba had to rely on those compact agreements to bring them in. So the state of emergency is able to elevate our asks as they find their way through those agreements that we have. In addition to that, and this doesn't take a state of emergency, but I think the fact that we see communities in pretty challenging situations, and families in pretty challenging situations. You see Saskatchewan people and municipalities come together. There were firefighters, municipal firefighters from the city of North Battleford that were spending time defending the community of La Ronge day after day from the fires that were coming in to that community. And that is really a testament, I think, to the leadership in the city of North Battleford and the Battlefords more generally, of which we have both mayors with us today, and I thank them. Through them, I thank the folks that went up and took the time to help those folks that were facing fire in La Ronge, and we saw that happen. Not just in the city of North Battleford, but we saw it happen in city and town and RM across this province, where municipal firefighters from across the province were finding their way to northern communities to assist in defending their homes in what was a very, very challenging spring.
Are you able to comment on the urgent care center in Regina? It's supposed to be open 24/7, but
Yeah.
The hours are not exactly that. So what work is being done, and what are your...
Do you want me to comment on it first?
Yeah.
I think, first and foremost, what started as a pilot project, and I spoke earlier to the access point for mental health and addictions care in that facility, and the importance of having those access points as we increase that provincial capacity. But I'll speak now to the urgent care side. And what started as a pilot project, and I think can be regarded as a very successful pilot project in providing the opportunity for people to access a medical health care professional in an urgent care scenario. So maybe not something that requires an emergency room care, but something that is more urgent than waiting 7 or 10 days to see your family physician in a primary care setting. And the urgent care is proving to be very valuable in that space. The volumes are proving out to be that, as they are, the urgent care volumes on a daily basis are coming close to actually what is being seen by either of the hospitals in Regina. And so significant volumes coming through in the 16 hours that are there. What we've asked the health authority to do in the Ministry of Health is to, look at where and when those volumes are peaking, and how can the urgent care center be of the greatest assistance in providing that access to a primary health care provider, whether it be for stitches, an x-ray, or even something more minor. Should it be concluded that those 16 hours are sufficient, and what we need to do actually is add a second urgent care center in that space, that might be the path forward. Should it be concluded that it should be open 24 hours, and in those other few hours there is enough need that it just simply can't be closed for those hours, then we would consider that as well. And so I think as this started as a pilot project, a highly successful pilot project in the number of people that it's seeing in the urgent care space. We are looking more at replicating it, not only another center or location in Regina, but expanding to Saskatoon, North Battleford, Prince Albert, and Moose Jaw. We might find that those 16 hours are the hours of the day where there is the most need. And in an environment where, we're continuing to work very hard to attract, healthcare professionals of all types and all designations, is to, have them working together in the team-based care that they have, seeing the highest number of patients that they have, and preserving that capacity across the system. So I think there's maybe some decisions that will be made in the time ahead, but they'll be made in consultation with some of the data that the Saskatchewan Health Authority has, the Ministry of Health and others. And I don't know if I got ahead of you on any of this, but you might want to
Yeah, I'll just-
anything to administer.
Yeah, I think the Premier said it very well. I mean, the whole point of urgent care centers are really another access point for people providing care, and really that kind of in-between care between what a typical emergency room would see in terms of acuity level, and then what you might go to see your primary care provider, whether it's a nurse practitioner or a family physician about. We have been working as the ministry, with the Saskatchewan Health Authority to evaluate the volumes that we're seeing at the urgent care center in the 16 hours it's currently open, but then also evaluate the volumes that we're seeing at both the Pasqua and the general emergency rooms overnight. You know, I think where we're likely to end up is the fact that the 16 hours that is open right now, I think that's what we'll continue to focus on. And then, as the Premier said, making sure that that same access point is available in more communities. Another location in Regina, another location in Saskatoon, beyond the one that's already under construction in partnership with the Takakook Cree developments. You know, I can say that we are working urgently on the urgent care centers in these other communities, engaging with the physician communities in North Battleford and Moose Jaw and Prince Albert to understand what they're able to offer as a physician group. But we are hearing, you know, time and time again from patients in Regina, really the value that they see in having access to the urgent care center. So it's more important that we increase the access points rather than the hours at this point.
Quick question for the.
Can I just ask the two mayors to maybe comment on this? Because when it comes to delivering health care, there's so many points. You know, we have our primary care facilities in our communities. We have our emergency room cares in our facilities. We're increasingly looking at how do you put, have capacity and access points for, mental health and recovery care as well. And one I think that is been discussed, again, another pilot project that is proving to be successful for those in search of recovery care with the self-referral rates coming out of our complex needs shelters in Saskatoon and Regina. I think other municipalities are very much looking at how do we use the the whole of opportunities that we have to provide the very best health care to people in our community and who are in our community, whether that be physical health care, whether it be mental health care or recovery services as well. And so Mayor Houghton and Mayor Leslie just might have a comment on that from the local leadership perspective.
Morning, Mayor Leslie, Town of Battleford. Just wanted to speak to the urgent care center. What we face today as our local BUH, Battleford's Union Hospital, is our emergency room is inundated with people who have nowhere to go. So they're coming in for what I would say is a non-urgent visit. So what it does is it makes it congested, and it creates these long wait times where for people, if we have something like an urgent care, they're able to go there and whether it's mental health or a sick child or things that aren't necessarily emergency cases. We're also facing in the province, a shortage of paramedics. So having an urgent care where they can go there instead of relying on the emergency services to bring them to our emergency room would be very critical for the Battlefords. And we've been advocating Minister Cockrell to be on that list, and I'm glad that we've been added to that list as one of the next communities that are going to have an urgent care center, because I think it is the way of the future. We can't continue to fill our emergency rooms with people who don't necessarily shouldn't be there, and I don't want to diminish the need for healthcare, but I think an urgent care center would address that need. So thank you for giving me a moment.
Yeah, good morning. Kelly Houghton, I'm the mayor of the city of North Battleford, and I could just speak a little bit to the maybe need for complex needs shelters or facilities in communities like ours. Just as Mayor Leslie was talking about the ability to divert people from emergency rooms to other points of healthcare facilities, we see the same issue in prison cells, unfortunately. We have folks that are struggling with addictions, that are maybe making choices that the only resource we have as a municipality is our policing to deal with. And so having an alternate avenue for those folks to maybe go and access recovery supports and help to get them on a path to a better life, a better future, I see huge value in that. And at this point, complex needs facilities are not, we're not on the list necessarily with the provincial government at this point, but the city of North Battleford will continue to talk to Premier Moe and his cabinet about the ability to bring that service to our community. We have many people struggling with addictions here that really don't belong in prison cells, and they deserve an opportunity to have a healthy future as well. And I think it's a great avenue to support that.
Quick question for the Premier. When you were getting back to Minister Cockrell's initial opening statements, when you were at the first ministers' meetings in Saskatoon with other provincial leadership and the federal government, with respect to bail reform, is this something that was talked about at that table? And if so, how has that led you to develop this kind of plan today?
Right, it's been in a number of communiques in the lead up to the First Minister's meeting. Not only was it part of that discussion, it was part of the letter that I had sent to Prime Minister Carney in advance of that. And since that point, I've had discussions at Prime Minister's request on a number of issues that we're trying to find a path forward on with the new Prime Minister and his government. But one of those issues most certainly is not only bail reform, but increased consequences for those individuals that are bringing these poisonous drugs like crystal meth and fentanyl into our communities. Just to go back to the last question as well, as 16 versus 24 hours in the urgent care center in Regina. What we're quite focused on right now is actually adding 6 more urgent care centers to the province, including one in North Battleford here. And I think that is the best use of not only human resources but capital resources that the province has right now, is to expand that access as quickly as possible into those 16 hours that seem to be the most need for families that require that service. But again, I think the conversation that we've had here today, and we're so very thankful for the mayors of Battleford and North Battleford for hosting us to have this conversation about the full continuum of how we support those, whether it be healthcare needs or healthcare needs that lead maybe into the mental health addiction space and the need for housing and some of the vulnerable situations that arise when addictions come into that conversation. And so, most certainly, I think as we find our way through time and we find the expansion of urgent care centers, complex needs shelters, healthcare services in general of all kinds, it also brings forward a conversation around policy. Things, policy initiatives like compassionate care, for example. To have a serious conversation around ensuring that people are receiving the care that they need, even when they may not be in a position to be able to make those decisions themselves. And so I think much conversation coming in the months ahead in not only how we are delivering health care and always being open to delivering it in different ways with the outcomes of the patient in mind, a patient's first effort, if you will, but also in the policy space when it comes to delivering mental health and addictions care as well.
When you say compassionate care, is that involuntary treatment?
Yeah, we've seen the conversation move forward in Alberta with respect to compassionate care. British Columbia is having a discussion about it, and I think very much in this province we've been having much of that discussion in the weeks and months gone by, and there are situations where individuals just simply aren't in a state to make their own health decisions. And at times there are judges that will actually move into that space. And it's a policy initiative that is being discussed in the Western provinces, and I think in other provinces across Canada as well. And it's one that we're certainly having a look at here in this province as well, with the best interest of individuals in mind. And when you talk to families and individuals that have all too many families and individuals that have been impacted by the poisonous drugs and addictions that they bring to individuals. There is a place for the discussion, and there's probably a place for this policy moving forward.
Just on bail reform, what are the specific requests from the province and the mayors?
Keep the people that are providing drugs and hurting people in our communities in jail. Those that unfortunately have slipped into a life of addictions, let's provide them a recovery opportunity. There are 2 paths forward, and none of those paths involve living in a very vulnerable state in our streets. One of the paths forward, and the path that we encourage all to entertain and trying to make accessible for all and available for all, is the opportunity for in this province, a provincial recovery bed. If your challenge is mental health, if it's unfortunately addictions to those poisonous substances like fentanyl and crystal meth, we want you in a recovery center, and we want you to be able to live a recovered life and to aspire to all that you may have been able to aspire to be before you'd entered that life of addiction. Second, for those that are bringing this poison into our community, you're going to go to jail. And we're going to have the police officers here to enforce the law, and we're asking the federal government, alongside many others, to increase the consequences of the laws we have in the Criminal Code of Canada for those people that are bringing those poisonous drugs into our community, into our province, and into our nation. There's no place for them here. Our intent is to eradicate crystal meth and to eradicate fentanyl from communities in this province, and we're going to do our level best to aspire to that.
But on bail reform, though, like, do you have like specific policy requests or legislation changes?
There is a number, and in fairness, there has been a few changes that have been made, but there are a number of additional changes, and they get fairly detailed in nature. I've outlined what the outcome is. They get fairly detailed in nature. And broadly asked for, I would say, by the chiefs of police across the province on numerous occasions, asked for by 2 municipal leaders and 2 provincial ministers here today in a letter to Minister Fraser. But I think as we move forward through the next number of days, I think to really impact on a new Prime Minister and to some degree, I'd say, a refreshed cabinet, the importance of bail reform and the importance of having significant consequences in place for people that are bringing this poison into our communities, often killing our friends and family. We're going to have very open discussions with our municipalities, our Indigenous leaders, and myself at a Council of Federation meeting later this month on, how can we best align our advocacy with this new Prime Minister and a refreshed cabinet so that they actually make the changes to the Criminal Code of Canada that keep families safe in community after community across this province and across this nation. Yes, we need the recovery opportunities, but we also need the assurances that our CMP, our municipal police officers, in our case, the Saskatchewan Marshals, our provincial police force, have the tools to ensure that when someone is a danger to themselves or someone else in their community, that they aren't going to be in that community free to do that. They're going to have to take a break, and if they do so repeatedly, the break is going to be much longer.
What are you gonna
Safety has
do?
been a priority of your government for a couple of years now.
Crime and safety and recovery, I would say.
Yes. Some of the changes, I guess, you've announced lately, is that sort of limited unless there are changes to the criminal code? Like the effectiveness of some of those changes?
Yeah, well, it's the Criminal Code of Canada. It's not the Criminal Code of Saskatchewan, right? And with respect to the Constitution, the Criminal Code of Canada has to be changed at the federal level. And so what we've asked our Minister of Justice and our Ministry of Justice to constantly have an eye to is what consequences can we increase provincially outside the Criminal Code of Canada to keep our communities and our families more safe. That's the goal, is to keep our communities and our families more safe. The secondary goal is also if you are unfortunately entered a life of addictions in some way and are maybe doing some illegal activities to support that life, we have a better place for you, and it's a recovery bed. We're creating access points and we're creating capacity to make those available. And so it's really a two-track approach, and the goal is to not have people that are vulnerable in the streets in a Saskatchewan community, but to have them either in a recovery bed, or if they refuse the recovery bed and insist on this life of addictions and crime that is often associated with it, unfortunately, you're not going to be available to do that in our communities.
So one of the things that we heard in the federal election talks is the 3 strikes rule. Is that something that you are kind of maybe hoping that the federal government now takes a look at?
The Minister of Justice might have a comment on the 3 strikes rule. There's been other policy initiatives thrown out by other premiers as well with respect to defending their home and defending their property. When it comes to some of the threats that I think largely can be attributed to addictions, availability of drugs, supporting the drug trade, supporting an addictive lifestyle. Let's deal with the source, which is making recovery accessible and having the capacity to ensure that everyone can access it when they choose to, but then also bringing in the enforcement tools that we need, the number of police officers, changing the Criminal Code of Canada so that they make that decision sooner. It is not all right to be living a life of addictions for the individual. If we can agree on this, the most vulnerable place for that individual is to be living a life of addictions in the streets in any community in Canada. Let's not make that the place where they want to be. Let's make the place where they want to be a recovery center, a provincial recovery center, and then start to transition into those homes and transition into assisted living and a better supported living and then a better lifestyle. That's the goal, and that's our aspiration, is to eradicate the drugs and to provide the opportunities for Saskatchewan people.
So when we think about addiction and recovery, are we hoping like an abstinence approach or more of like that long-term three-prong approach that healthcare professionals keep talking about?
We want it out of Saskatchewan, not available. And so if you're bringing it here, you'll be arrested. If you're using it, we want you to enter recovery bed so you no longer will be using it. And so the day that we have no fentanyl, no crystal meth, and no addictive substances in the province, that's the goal of the government. And some may say, that's not a realistic goal. Doesn't mean we shouldn't work towards it, and that's what we're doing.
Thanks, everyone.
I'm wondering if the mayors will talk about their role in
Yeah,
the
sure.
bail reform letter and kind of what they're asking for, complex needs shelters, things like that. Because we haven't heard about you guys speak on it yet, and it'd kind of be nice.
Sure. I've already spoke a little bit about complex needs shelters, but in terms of the sort of why we want to join in partnership with the provincial government and ask for changes in bail reform. For a number of years, we've heard from our RCMP and our chief of police that the biggest volume of crimes that happen in our community, the most serious crimes, are being committed by repeat and violent offenders. It's taxing our police resources, and it's putting our vulnerable community at risk, having these types of people free to be in our streets. So in order to use our resources more effectively, we really want those violent repeat offenders dealt with and taken off of our streets and out of our communities. We're not asking for more people in prison. We're asking for the right people to be in prison. And, those folks that are more vulnerable, or all of our community safety efforts, we put a lot of investment into proactive initiatives to try to combat crime down the road. But that stuff is not effective if these repeat violent offenders get to be on the street corner, recruiting, selling drugs, this type of action. So that's the impetus of us asking for this. We see the effect here, and we know we need change.
Yeah, I think from my perspective, it's that habitual individuals committing crime. We have a few individuals in this community that are 4 to 5 years over the age of majority who have over 100 charges or entries into their thing. So those individuals we need to focus on. We invest in gang units, we invest in PAC units, we are investing in more RCMP. And as they do their jobs, the crime element starts to come over to the town. It starts to go to the regional municipalities. So we're not actually curing the crime. We're actually just dispersing it because they get arrested and they get released. So we're asking for bail reform is find some other solutions instead of just wasting the time of our law enforcement agencies, we're wasting the time of our Crown prosecutors, wasting the time of our judges and court systems. Let's find a solution to make sure they can't come back on the street and commit 5 or 6 more crimes. Many in this room have probably reported on the image of the Battlefords of being an unsafe community. And then I'll challenge that here today and say the Battlefords are one of the safest communities I've traveled in the last 3-4 months. But we have this stigma because of a few individuals in our community that continue to commit these crimes, giving us a bad reputation. And part of this bail reform will help us change that image of the Battlefords and hopefully bring more people to our wonderful community.
So just to add on that, sorry, just to the mayor, as you talked about, unfortunately there is those high crime statistics that unfortunately we've all had to report on. Is there something that people at the community level are hoping that people understand on a wider level that Battlefords is a safe place to be, or Battleford is a safe place to be?
I would challenge you all to drive around, take your cameras, and take some pictures. Right, the community speaks for itself if you come here and see it. And our residents are just asking for a little bit of support from the provincial and the national level to just see how amazing of a community the Battlefords are, and just give us our time in the limelight to show us what we can do.
Thank you. I might just add to that if I can. We would also, of course, challenge the reputational issues with the statistical influence of the Crime Severity Index over years. And, of course, you would all know that over the last 2 years, the ranking of communities under 15,000 population have been removed and rescinded from Stats Canada because there was an acknowledgement that there was a flaw in the way that those statistics were being reported. So I encourage you as well to take a drive around. You'll see what we see. This is a beautiful community with many, many good people. We have struggles. We have struggles like every other municipality across the entire nation. But I would dare to guess that you'll see a lot more beauty here than fear or that type of issue.
But that's a bit in contradiction because I thought that North Battleford and Battleford was chosen to be like to police because of the crime statistic?
Well, part of that, maybe that's a question for you, but I know it's a provincial training facility for RCMP.
Not RCMP, new provincial
Oh,
police.
okay, I'll let
Yeah, I'll just say, I think both Mayor Leslie and Mayor Houghton, you can hear the passion in the voices of those that live in the Battlefords. We haven't really appreciated the way that our community's been displayed publicly over the last number of years, and I think I credit the local municipalities and really local Indigenous leaders too for advocating for the changes that had to be made to the crime severity index. Now, that being said, as we're talking about today around the topic of bail reform, we continue to need to have more resources on the ground. That's why the Saskatchewan Marshal Service is opening their second regional office right here in the Battlefords, opening up in the fall. That's why we're converting the old liquor store downtown to a new training facility for the RCMP. That lease was just finalized in the last couple of weeks here, and we look forward to being able to train more RCMP officers, both from the Battlefords, but also from northern communities, whether that be communities like Meadow Lake or Beauval or Laloche, to be able to train them right here in the Northwest instead of those officers having to go south to Regina. So again, this is a place where we recognize there's challenges. We don't think that it's commensurate with the way the community has been talked about in previous years. But there are still continue to be challenges, and that's why both the province, the municipalities are making investments around community safety, right? And we heard it's not just around policing. There's also investments being made around addiction support and healthcare access in our community. But, there continues to be challenges, and that's why we'll continue to put resources to address that challenges so that really our residents feel safe at the end of the day.
Sorry guys, that's it.
Thank you.
It's nice and warm in here.
I'll elaborate on that actually if I could. Yeah. That's all right.
We're all getting ready.
Everybody's warm, I know. I just wanted to elaborate on the points that Mayor Houghton and Minister Cockrell were saying about the regional office for the Saskatchewan Marshal Service and how the choice of that location, I don't want there to be any misunderstanding that that's somehow a negative reflection on the community of the Battlefords. Quite the opposite, in fact. Those regional offices, and there will be more announced, are meant to disperse the Saskatchewan Marshals across the province, and they will be in smaller communities so that they have access points to support every corner of this province. And the fantastic relationships that we have with the communities of the Battlefords, with the surrounding Indigenous communities, really made this an ideal location for one of those regional offices, the first of many that will come. And so just to be clear that it's really a positive reflection on the communities as why the first of the Saskatchewan Marshals regional offices was chosen to be here.
By the way, did the federal government answer your request for help for the base camp already? The request you made on Monday?
I'm not sure which request you're talking about.
We wrote an article that you requested on Monday help from the federal government to build base camp for the reconstruction of the north because of the wildfires. Did you have a response from them?
The announcement on Monday was the province is investing an additional $20 million to help communities that were devastated by the wildfires with their cleanup efforts and restoring those communities to a place where they can begin to rebuild. That was a $20 million investment committed to by the province of Saskatchewan.
But you also asked for the help from the federal government, if I'm not mistaken.
The request I think that you're referring to for camps occurred about a month ago. We did hear back from the federal government that that's not something that the military currently does anymore, but they've put us in touch with contractors that do that sort of work, and those conversations evolve over time based on the needs of each individual community. And with the announcement on Monday, what we had indicated was that we're working together with the communities who are leading the rebuilding efforts and the cleanup efforts in their communities so that they can choose the contractors that they wish and that make the most sense for them. And our recovery task team will work right alongside those communities, providing them with whatever supports they need, and that additional $20 million is there for that purpose.
So the federal did not give you, they just give you name for a contractor, just to be sure. English is my second language.
I can
It's
follow
okay.
up on that.
Sure, Ashley can help you. Thank you. Thanks, everyone.
Thank you, guys. No, we're done. Okay. Thank you guys.